Excellent. Hello, friends, Kenosha County. Good afternoon. I'm Brandon Morris, the Manager of Community Engagement with Building Our Future, and welcome. Welcome to Reaching Out, a virtual Kenosha County Community Resource Series, the series of 4. We are on our 3rd this afternoon, and we have some special guests that are going to be building awareness for us. They're going to be building awareness around the mental health, behavioral health, and dental here in Kenosha, all of those resources. Again, this is for emergency services and opportunities for our community to know where the services that are available to them and around those items. So this is going to be, it's the who you can call right now, all about access. And I want to introduce our special guest today. We have Dr. Claire on the line. Dr. Claire, how are you?
Hi, thank you so much for introducing me, Brandon. My name is Dr. Claire Lewandowski. I just go by Dr. Claire. I'm a clinical psychologist and behavioral health therapy supervisor here at Kenosha Community Health Center. I've been here for the past couple years, and I'm happy to talk with everyone.
Excellent, thank you for that. We also have Melissa with us.
Thank you, Brandon. Yes, Melissa Caprillion, and I am the Business Development Liaison for Kenosha Community Health Center. Really working a lot with the patients and out in the community to bring great service. Thank you.
Thank you, Melissa. And we have my good friend, Carrie. Carrie, how are you?
I am well, Brandon. Thank you so much for moderating. It makes me feel a little bit more relaxed. I'm a bit nervous talking into just Facebook Live without seeing everyone. So I appreciate you being here for us very much. Also, thanks, before I introduce myself, thank you to Lori, Tamara, and to Karen with ESN for organizing this. I appreciate the effort very, very much. So I'm Carrie Foss. I work for Kenosha County's Division of Aging, Disability, and Behavioral Health. I'm the Behavioral Health Manager. Prior to my employment at the county, I worked for Kenosha Human Development Services, KIDS, or if you've been around our community long enough, KHDS or KIDS. I worked within the crisis programs. And so my 24 years there, I worked from a crisis worker to an involuntary hospitalization liaison to the manager of that program, adult residential coordinator. And then when I ended my time there, I was the director of crisis services. So I'm really excited to talk about this topic.
Excellent. Thank you, Carrie. So again, this series is brought to you by the members of the Emergency Service Network, aka ESN. And let's start off with Dr. Claire. Can you tell us a little bit about what you do, the resources you bring to our Kenosha community?
Absolutely. Well, so first off, I'd just like to highlight that I am trained as a clinical health psychologist. And a lot of the work that I do here at KCHC with our team members is really focused on the whole person, their mind, their body, and what is important to them. And we have been facing as a nation, as a global community, facing some very difficult times. We also very locally have some unique challenges as well. So I just first want to start out by acknowledging that there is a lot of discomfort that people have been experiencing in this last year or longer. One of the things that we in our mental health and behavioral health field really focus on is how people can cope or manage when the world seems to be crumbling around them. I might liken this to something like an earthquake, right? You can imagine, for us in Wisconsin, don't get too many earthquakes here, but you can imagine what it might be like when the world is just shaking around you. You're going on your path and out of the blue, boom, everything just rattling. You might lose kind of your footing and fall to the ground. The earth might still be shaking around you and you're just trying to make it through, hunkering down, making sure that nothing kind of hits you in the face. And that's what it's been like for a lot of folks. There's still some bit of rumbles happening. There's like these aftershocks. And so during COVID-19 and parts of our community being faced with unrest, all of this has been just an incredible stressor for folks. Perhaps losing jobs, having yourself or loved ones experiencing COVID and coming down with some really very difficult symptoms that take us away from what we want to be doing. And so as we think about that response for all of us, everyone's going through some type of stressor or adversity. When we think about these unique challenges, they can alter really our bodies, right? There's this neurochemical change, like our brains are a little bit different trying to react to these threats and these stressors. And so when this happens, there's many natural responses that our human bodies bring up to cope with this. Might not be the most comfortable, but I just want to address that for most people, this means things like increased physical tension, just our bodies feeling unwell, trouble with our stomachs, difficulty sleeping, difficulty eating. Maybe the way that we used to manage that stress when it would come up every once in a while is now lost to us, or maybe temporarily not available. If we're used to maybe connecting to people in person, especially when we're thinking about safety precautions, now that outlet isn't there, of course, it's going to really create a very uncomfortable situation and sometimes can take a longer term toll. So when we think about behavioral health services, we're trying to really look at the whole person and how they're being impacted in that moment. What is their well-being like? There are some times when we haven't been able to pick ourselves back up from that earthquake, right? We're all trying to slowly put one foot in front of the other, stand back up, dust ourselves off, and try to take a look at what this landscape is like. We're all trying to figure out, what is this path? And so some of us have been able to, some of us have been able to start taking steps moving forward. Maybe the earthquake wasn't so big for them. Others, it has been devastating. The landscape is very different. And so if you are someone, whoever may be listening to this or us on the panel, have experienced these stressors that have become chronic, where that discomfort in our body just keeps going on day to day, where our sleep continues to be disrupted, or our routines, being able to go to work or connect with people in a meaningful way. If that has continued to really be a struggle, that's a time where I think it's important for people to know that there is help. Help is available. We at Kenosha Community Health Center are really trying to take a team-based approach to this. One of the steps can be connecting with your primary care doc, setting up a regular visit to say, I am struggling. That doc themselves might be able to help you with managing some of the basics, like how are you doing on your health? How are you doing with managing diabetes? You know, for any of us, that can be really tough to do the regular day-to-day kind of effort to manage what our body is getting. And so sometimes we got to start with the simple things. How are we eating? How are we sleeping? The other things that a person could do, and I would really encourage this for most folks, just to at least try it out, is to see if there's a therapist or a counselor that you can speak to. At KCHC, it would be trying to just give a call up to our number and say, hey, I'm interested in talking to somebody about what's been happening lately. There's lots of different resources in a therapy setting like this. You kind of see behind me what that room would maybe look like. But sitting down and talking with someone like me or a team member that I have, there's also really wonderful community partners that we have as well in Kenosha. But sitting down with them and really talking through, here's what's been happening. Being able to put words on things can be the first really important step to identifying how do we pick ourselves back up? How do we make sense of this earthquake? And how do we move forward? So I think I just wanted to start by acknowledging some of that and really encouraging folks to partner with some of their providers, either a medical care provider or establishing, connecting with someone like me, a counselor or a therapist, a psychologist. Any of those roles would really be very useful.
Excellent. So there is one question that just came in. You mentioned a therapist or a counselor, and you're encouraging that. Is there any type of label that will be put on you if you're meeting with a therapist or a counselor?
That is a great question. Of course, there are these ideas or stories we think about. It's like, well, what will happen if I go to someone like this? Am I going to be called names? So there are some really strong words that people have seen in things like movies. Like, am I going to be called crazy? I think first and foremost, I would share, no, I'm not going to be calling you crazy. If anyone is experiencing these types of symptoms, you're very normal. Your body is reacting in ways that we would expect. So it wouldn't be a label put on you. Sometimes a person may meet criteria for a condition, like if there's a certain condition like anxiety or depression, that might help the person that you're working with really tailor what kinds of skills and strategies would help you best, just from the evidence and the research we have. But that doesn't mean that that name paints you as all of one thing. I would respond in that way. I hope that answers the question.
Excellent. And then a follow-up question to that would be, they came into your offices. How do they know who to ask for?
Yeah. So if somebody walked in, first off, if somebody walked in because of COVID, we would be asking them basic questions like, have you had any recent symptoms, fever, things like that. But asking, just simply saying, I'm interested in talking with somebody like a therapist. That kind of very generic language will get you to where you need. Mm-hmm. Yeah.
Excellent. So let's say someone does come in and they're asking, hey, I need to speak to a therapist or a counselor. Is it normal for a person to get in right away that day, or they kind of have to set an appointment?
So it depends on where you go. Everything has changed a bit again during the middle of COVID. For my clinic, KCHC, we have a couple different options for folks. First off, whenever anybody's interested in establishing services, like starting out and meeting for the first time with a therapist or counselor, they would expect to talk with one of our team members. Oftentimes it's someone that's has the title of a case manager. You don't need to know that, but it's one of our team members to ask questions about what's been happening lately. What are some of the unique challenges that you've had? Are you having trouble with maybe affording food, or having trouble with making sure that you've got a safe place to stay at night? Because the first thing we want to do is really make sure that this person has access to resources that get them what they need to feel safe and secure first and foremost. That's going to be number one, no matter what. So they'll ask those kinds of questions, and then they might give a person extra information, things like the 211 number or other specific community agencies, and maybe sit down and call with them to those different areas to make sure that they get the help that they need. And so we start off on a good footing. And then for us at KCHC, it's typically an appointment within about 7 days to be scheduled and have your first appointment with a therapist. Mm-hmm.
Excellent. And so do I have to have insurance if I come in there and I want to see a counselor or a therapist?
Great question. This is a really important point. Folks that we see at Kenosha Community Health Center do not need to have insurance. We do provide services on a sliding scale fee. So based on how much you might be able to afford, we take a look at your proof of income. We work with you to identify ways to kind of kind of verify how much you're making so that we can see, okay, based on that and how many people are maybe in your household or that you also need to take care of, how much would a standard and reasonable rate be for you? So that would be a quick conversation with one of our staff members, and we could help someone through that. Mm-hmm.
And then one last question before if I want to open it up to Carrie or Melissa. How do I know I can trust that you guys are going to be sharing my business?
So I get this one a lot. And I even tell people this now the first time that I meet them. So Brandon, if you were coming in to see me here in this office, we're in a really secure location. We don't let anybody else like listen in. The other piece is if I were to see you or know that you're even scheduled to see me next week, and then I saw you maybe in the grocery store, I couldn't even say hi. I can't acknowledge that I know you at all. If you were to say hi to me first, then I would assume that you're giving me permission to acknowledge that I know who you are. But everything is kept incredibly private and incredibly secure so that we make sure nobody is going to know that you're coming to see someone like me. I would hope that there's less stigma or discomfort in people knowing this. I think we're doing a better job as people learn more and more about what treatment or therapy is like. It's basically, it's a conversation to help a person manage what's coming up for them, what their body and their mind's giving them, and how they can move forward. So I hope we're doing better at that, but we do keep everything incredibly private, just so you and everyone else who's listening knows.
Excellent.
I was just going to share one small other
Go ahead. Yep.
Because of some of the unique challenges that folks have had, especially trying to keep safe amidst the pandemic, we've also launched telehealth services, so video-based services. It looks a lot like what this is looking like right now. So for some folks, if that's an appropriate service for them, we might be able to also do that initial appointment over a virtual platform, and it's all incredibly private. It's encrypted. Nobody's going to know about that either.
Excellent. So we are in the world of videos and screenshots and everything else. Let's say someone is listening to this video maybe a couple of days from now on our Kenosha, United Way Kenosha County's Facebook page, and they see your picture, but they don't remember your name or don't know how to pronounce it. If they walk into your facility, is there some way where they can look at find your picture and say, I want to speak to her. She said that I can come in and get help.
Yeah. Well, so I think the easiest way would be to look at our website, kenoshachc.org. That's got all of our pictures of all of our providers, our dentists, our hygienists, our medical providers, everybody there that you would need to try to figure out, okay, what was her name again? You could look on there. Mm-hmm.
Yeah. So sorry, let me just rephrase it. Let's say I don't have that access to the internet and everything, and I walked in. How would I know? Like, man, I saw this doctor on Facebook Live, but I don't know her name. She said I can come in here for help.
So first off, I think if you walked into our clinic and said that, they'd probably know.
Okay.
They'd know. So they'd be able to say, oh, okay, was she saying like to help just with coping? I know the person you mean.
Excellent.
Yeah.
Excellent. Thank you. Melissa, Carrie, any other questions you have to throw out there?
I just wanted to kind of reinforce a point that Dr. Claire made. So if anyone was listening in here and really feeling like some of those feelings or symptoms that Dr. Claire was expressing, but they have an upcoming dental appointment or medical appointment with Kenosha Community Health Center. Dr. Claire mentioned earlier that we have this team-based approach. So please feel free to share some of those symptoms, and they'll be right away. We are all about treating a holistic approach, treating the whole patient, and we'll make those connections right then and there and give you the next steps to be able to see someone like Dr. Claire. So thank you for allowing me to add that point.
Okay, let me ask you a question, because when I was younger, All right. Even still now, I'm afraid of the dentist. Uh, yeah. So if I came in there and I needed some dental work done, do you guys, how does that work? If I'm like, God, I have this pain in my tooth and I don't know what to do, but this is the place I'm here. Can you guys help me?
Yeah, are you talking about having a little bit of anxiety going into the dentist office?
Yeah,
Yeah,
definitely.
yeah. So there is an assessment tool, and I'm actually going to pass this over to Dr. Claire, and then she can talk about that, because we do have the case managers who do work alongside and address those patients that come in who may have anxiety or other needs.
Excellent. Thank you.
Yeah. So first off, you are not alone in this. Lots of folks end up having that kind of discomfort, and just feels a bit frightening when we're going in and having somebody take a look at our mouths. So you're not alone. And there are some really good strategies that we could also work on in a therapy setting to try to prepare ourselves for those uncomfortable situations. We also have some ways that we can try to partner with the hygienist or dentist that you're working with. And it could be even in the clinic, to make sure that we can kind of have everybody on the same page, know what to expect, and help kind of talk through things little by little to make it a little more approachable. The other piece that might be nice to know is that so I talked about the sliding scale fee, so if you have insurance, great, we can see you. If you don't have insurance, that's fine too. We can see you. We can even see if you're able to, if you might qualify for insurance through the state. We can help with that process. And if you have an emergency, if you have not seen us before at Kenosha Community Health Center, but you maybe have pain in a tooth, a chipped tooth, something like this, you don't need to necessarily be a patient of ours to call us up and see if we can maybe squeeze you in. We try to take on those kind of like emergency acute dental cases, at least getting somebody to take a look at it and to give you a plan or some next steps within a day or two, as best we can.
Excellent. Thank you for that. All righty. This is time for a commercial break. Just for all of you guys out there listening, remember to use the 211 service as well as our ESN website, which is www.esnkenosha.org. So use those services and it'll help you get to some of the emergency resources that we are talking about today, or more so Dr. Claire, Melissa, and Carrie. Again, this series is brought to you by the members of Emergency Service Network. And this Kenosha Virtual Resource Fair is the third. We have one more coming up next month, and we'll talk a little bit more about that at the end of the fair. On to my good friend Carrie. Carrie, can
Thanks,
you
Brandon.
tell us
I
about the
appreciate that.
resources?
I will. So I want to start with saying, of course, Kenosha County provides many resources for people struggling with behavioral health issues, mental health, or substance abuse issues. But for the purposes of this conversation, we are really going to focus on what can we do in the moment? What is available to someone in the moment? And certainly, I'm going to start with crisis. Crisis has been around in this community for 40 years, well before I came into the picture. And there's been a lot of recent modernization of the crisis programs in the last few years. So I'll start with that. In about 2017, an initiative started, I'm so proud to talk about it, with Kenosha County and the city of Kenosha, put together the resources to allow the opening of Kenosha Human Development Services Crisis Prevention Center. So that is located at 1202 60th Street, but the same crisis number everybody knows is the 657-7188. At the Crisis Prevention Center houses the crisis unit, also houses the care center, which I can talk about in a little bit. So they moved in 18, and it's almost hard to believe it was that long ago. But that new location has afforded the crisis unit to really take a look at the cross training of crisis workers. It's not so much where it's adult crisis and juvenile crisis, it's crisis that can respond to the entire family needs. And the idea of not compartmentalizing someone's crisis and it not affecting the family. So that's been a really exciting turn for the crisis units. So what does it offer? First off, it's 24/7, 365. They never close. And when you call the 657-7188, that's never going to be answered by an automated. It's never going to be a voicemail. You are always going to have someone answer that phone. And it's going to be a well-trained, dedicated crisis worker answering that phone every time you call that number. That can provide either the phone services or provide face-to-face services. So that idea of who is calling crisis, who should call? Is it you or someone you know are experiencing just really a wide range of needs, feeling suicidal, angry, depressed, or anxious, substance abuse problems, lonely, isolated, family conflicts, or just family disputes, physical, emotional abuse, certainly individuals that are having problems at school, not necessarily academic struggles, but problems within the school setting. The transition into school is always historically been a really difficult thing for a child and adolescents. COVID has not helped that. And as we continue to evolve during Safer at Home and COVID and the pandemic, this transition has really become very difficult for some members of our community. Certainly academic issues don't have to be child and adolescents. With the University of Parkside, Carthage, and Gateway, we certainly get a lot of calls regarding that as well. Runaway issues, or just someone that needs to talk. The combined unit can address any of the emergent mental health and abuse needs of individuals, children, and the family as a whole. So there's a lot of phone contact that has happened. Certainly within COVID, there has been more phone than face-to-face, although face-to-face has never stopped. The crisis unit never stopped going out, never stopped doing an assessment. So when we talk about the person calling who's in crisis, we talk about family members or community members calling about their loved ones or their neighbors or a coworker. That happens a lot. But the other part of our connection with our community is our stakeholders, our shareholders, our community partners. And that, again, is something I am so proud to talk about. That not only is our connection with Dr. Claire, her team at the community health clinic, but the deep connections that crisis has with every school in Kenosha County, not just Unified, but every school, private or public, with our local law enforcement agencies. We work hand in hand with local law enforcement. There's a specific service within the crisis unit called the Community Response Counselor. This individual has a direct connection, and is when that position is working, they're waiting for law enforcement to call for this assist. This is a behavioral health issue. When we think about behavioral health in our community, it is law enforcement that is responding. But a mental health crisis is not a public safety issue, it's a public health issue. And so we have developed a lot of strong connections with our law enforcement to recognize that and call in crisis to assist with any problem solving that may be needed. This person works with all of the law enforcement agencies in town. And again, you have to think beyond our city police. We have our county sheriffs, we have Twin Lakes Police Department, University of Parkside, and then Pleasant Prairie Police Department as well. So we have ongoing connections with all of our law enforcement. Also talking about our emergency rooms with our 3 emergency departments within Kenosha. We are called often by the emergency department social workers, nurses, and doctors to come and talk about what services are available. So we really like to pride ourselves in this just really deep network. Crisis isn't just the people that work at that crisis prevention center. Crisis is just this giant team of community members. And I'm really proud of how far we've come in our community about not compartmentalizing that this is a behavioral health issue, so we're just going to call crisis. No, just like Dr. Claire had mentioned, this is an individual, this is a whole person. And you can't just look at one piece of that. So we talked about what else could happen. Say they were to be contacted by law enforcement or an emergency department, and someone has presented because they're really struggling, perhaps symptomology, perhaps there's feelings of helpless and some suicidal ideations, thoughts of suicide. There are a lot of mechanisms and a lot of strategies to either de-escalate, to find natural supports to help the person in the moment, talk about already established providers in the community, connecting with that. But when someone is feeling unsafe for whatever reason, unsafe in their home, unsafe with their thoughts, unsafe with their behavior, whatever that may be, there is the care center. And the care center is a crisis stabilization facility run under the crisis, under the crisis umbrella. So that idea is that we have the facility. It's currently 16 beds, although during the pandemic, we are operating on 9 beds. That allows everyone to have an individual room. So there is a little bit of a decrease in bed availability. But if you were offered an opportunity to access the care center, or if you're listening and you ever ask availability for the care center, that is access through the crisis unit. They gatekeep all of those services. And there you would find the ability to have a safe place where your meals are provided, you're monitored, self-administering your medication. All of your services could be coordinated, whether they are already established. We reach out to person's providers, not just behavioral health providers, but also your medical providers, if you have any. If you don't have a treating prescriber for behavioral health issues, you can see one at the care center. What's interesting about all of the services, and I want everybody to hear about this, there is no cost to the person to access any of this care. There is no cost to a person to call crisis. There's no cost for a phone or an in-person. There is no cost for a stay at the care center. This is eligible for people, for Kenosha County residents, for people in our community. This is there for you. And again, the modernization of all of this and this idea that Kenosha County and the city came together to pool their resources just shows the deep commitment that both those entities have to these issues. There is no inpatient psychiatric facility in Kenosha. We're all aware of that. So this was the response, and it's pretty phenomenal. If you were to, when I look at data and look at numbers, it's hard to look at the last 365 days because it's skewed with a pandemic. So if I look at the year, at most, 19, there were 300 individuals that went into a psychiatric institute involuntarily. There were over 900 individuals that utilized the care center. So our ability to provide hospital diversion, again, free of charge, is a huge asset to our community. And again, those are services you can access right now with a call to crisis. When you're at the care center, again, we talk a lot about having that safe environment, of course, while connecting individuals with services and resources that they're going to need once they leave. The average length of stay is around 4 to 5 days, so it is a short stay. It's not much shorter than an average inpatient psychiatric stay, to be honest, which runs around 7 days about. So when we're talking about how do we connect people with resources, the crisis unit is able to provide linkage and follow-up for those short-term situational crises that happen. Everybody that has a mental health crisis, behavioral health crisis, isn't suffering from a severe and persistent mental health issue that you're going to need to see a psychiatrist and have to be put on medication. That's not the response. Perhaps it's a family conflict. Perhaps that was precipitated by financial stress, employment, relationship stress, school stress, friends. There's a lot of times that a mental health, behavioral health crisis can occur in an external fashion. And so there's a lot of ways that the crisis unit can help mitigate those issues. Perhaps it's connecting with folks like Dr. Claire and for therapy, something that is situational and isn't going to need this really long term. So there's some linkage and follow-up. If the situation requires more involvement than therapy, and perhaps you need kind of a more intense or comprehensive support after your crisis, the Kenosha Human Development Services also runs the Community Resource Center. So when you talk about, I need something now, I need someone to talk to this instant to talk about issues, I'm in crisis, that's that crisis number. But perhaps you're thinking, I don't know where to begin. I think I need help with something, but I don't know where to begin. I don't even know how to articulate what I need. I just know I'm struggling. That's a real thing. Not many people come to any of our doors saying, I have a generalized anxiety disorder and I think I need, no one says that. No one feels those emotions. Just say, well, I lost my job and I'm facing eviction and my relationship is struggling and I'm feeling angry and now I'm thinking about hurting myself. That's how you come to the door and ask for help. And we all understand that. That's what we expect. So if you feel like perhaps you want to call, but is it a crisis? I don't know if I'm in crisis. Again, there's the resource center. So Kenosha Human Development Services, again, offers and is contracted to offer all of the crisis services. They're also contracted to offer the resource center. Now, that office has moved during the pandemic, and their new address is 3536 52nd Street. And I always have to actually look at the number because I have the 7188 number just as in my head all the time. So their main office number is 764-8555. All of this information can be found at khds.org. Everything that I'm sharing today. So you're calling the resource center. Why are you calling the resource center? And it's overwhelming to think about the different programs and services available in the Kenosha area. And that's hard to think about how do I even start? So you call the resource center, which that does operate on general business hours. And you're going to talk and explain why you're calling, what has led you to make this call. And the person on the other line is going to help you navigate using the broad services, resources that they manage. And that's going to help you or that loved one find all the help they need. There's that deep connection with other agencies across southeastern Wisconsin, but also across the country. And when you call the resource center, their motto, their idea is they mean it. If they can't help you, they know who can. And so that's really understanding the parameters and the broad idea of when you need help. Not every single agency or entity understands, has the answers or ability to help, but we have to be able to know when we can ask others for help. So you're calling the resource center. You could just perhaps need that information and referral, navigating systems, finding appropriate services. Where do you begin? So they're going to talk a lot about outpatient therapy, psychiatry. Oh my goodness, you need to start with insurance. A lot of the similar experience you would have at the community health clinic with any, kind of front door organization. Let's talk about, you need a help and assistance. Well, let's make sure you have access to that. Perhaps there are things you're entitled to. Let us help you figure out what you're entitled to through benefits and services. The other part of the resource, the General Resource Center is the Resource Center of Kenosha County. There you're going to find the response to have that clear, identifiable place to obtain mental health, alcohol, and drug, some very deep level. I kind of talked about all of the other services that are available that perhaps you need a lot more than just outpatient now. And once we find out and get to know you a little bit better, perhaps case management, that's something that's available to you. Everything at the Resource Center, it can help you access absolutely everything.
Excellent, excellent. Thank you for that, Carrie. We got a couple of questions coming in on our Facebook Live feed. One young lady wants to know if the person experiencing the mental health crisis has had previous police contact and the contact was not a good interaction. Is there a line for families to call crisis before involving the police?
Absolutely. Crisis does not require police involvement first. That idea that there, of course, crisis is able to provide an intervention with law enforcement. But the name of the building, when I talk about modernization, this is the Crisis Prevention Center. If you think, is it time to call crisis? If you're even contemplating calling crisis, I'm here to tell you it's time to call crisis. There is no waiting. There is no need to wait for that crisis to escalate to a point of a law enforcement response. So if you're thinking about the need and support for your loved one, call now. You don't have to wait for law enforcement, absolutely. And it is the 7188 number. We want to make sure our community knows there's one number. There's not alternate numbers for different issues. There's one number. That's what it is.
Excellent, excellent. And another question here, is crisis services available on the weekends?
Crisis services, it never closes. Someone answers that 7188, a person that works for Kenosha Human Development Services Crisis Unit is always answering that call. I will say that there are times where it's busy and perhaps a mobile worker cannot get out in that moment, but a mobile worker will be dispatched and you will know how long it will take for someone to come to you. But there is always someone to speak to. And so what I tell you, we're open Christmas Eve, Christmas morning, Easter. It does not close.
Wow, that is amazing. Another question that's coming in here. Sorry, so it says, I don't know where to start to get help for my problems. Can someone help me even if I'm not in a crisis right now?
Yeah, absolutely. Like I had mentioned, and I'm so glad I have an opportunity to talk about it because it can't be said enough. We don't expect any caller to know exactly the type of service they want, but we do hope that every caller will let us know what led them to make that call. And it could be as vague as, I'm just so anxious, or I'm just feel angry all the time. That's fine. That's a place for us to start. That's a place for us to start that conversation. Again, there's no wrong number to call. I talked about the crisis number. I talked about the resource center number. You can call either number. They're deeply connected. And so it is not uncommon for someone to answer the crisis line and to say, wow, this sounds like things have de-escalated, or you're in a safe spot, and the person feels comfortable and they're very happy to follow up with the resource center, or the resource center will call crisis and say, we need a response from crisis now to help this person with emergent need. So we don't expect anyone to know what they're asking for. We just expect someone that calls us is willing to talk. And if you don't even know how to articulate it, that's fine. Crisis workers are very well trained on how to start that conversation for you.
Excellent. Another question coming in on our Facebook Live feed. Can you call crisis for a person that may not want help? And if so, what are the steps that follow?
So this is really difficult. And if you have someone in your life that you are recognizing is struggling for whatever reason, but they are not interested in obtaining help, that's a crisis too. You know, caregivers and loved ones are in a crisis too. This affects everyone. There are opportunities to talk about engaging in help. There's language that can be used. I know that you had asked Dr. Claire about stigma and labels. It runs very deep. It runs very deep. And when we talk about labels and stigma, we think about those terrible things that are said for people who are dealing with behavioral health issues. And I'm going to ask everyone to think about for a moment, behavioral health, this is still a health crisis. So when you think of someone who is faced with challenges of a medical crisis, perhaps cancer, when you're thinking of someone battling cancer, what are the words we use? they're brave, they're a warrior, they're heroic. We lift that person up so much, as we should. But then you think about our community members, our loved ones that are struggling with behavioral health issues. And what words do you think of? Dangerous, crazy? It's still a health crisis. And I would challenge all of our listeners to think about, it's heroic, it's brave, it's exposed, it's vulnerable. Everyone that is dealing with a whatever crisis that may be. And so knowing that those are our thoughts, that's what you will be welcomed with. We want you to help refrain the thoughts of engaging in recovery in that way, like anyone else that would be dealing with a cancer or COVID. You know, we think of people that struggle like that.
So basically, there's no judgment. I mean, somebody that's rich or poor can call the services and get help.
We do not discriminate, financial or otherwise. We have, in my time at Crisis, and I know this is shared by the unit currently too, we're very aware that we may be meeting people on the worst day of their life. Very aware of that. And so to know that someone is genuinely concerned at the moment and genuinely interested in everything behind that one snapshot, you're getting one quick snapshot of perhaps the worst day of their life, but there's so much more there. We know that. And I also think at this point in society and all of our lives, it really is hard for anybody to look within themselves and within their family to not be able to identify with people who are struggling with behavioral health issues, either mental health or substance abuse addiction. I just don't think that there's a family out there that can't identify with that. So at Brandon, no judgment, no stigma, absolutely not. As a matter of fact, we would want to challenge you and your support team to really reframe that idea of mental health recovery. It's so very possible.
Excellent. Wow, that's powerful. And earlier in the call, you mentioned a relationship with the law enforcement. Now, does Crisis show up on the scene, or is it kind of like they assess the scene and then maybe they say, okay, we need to call Crisis?
That's it. There is no hard and fast rule of that. That is very fluid. There are often times that 911 dispatchers will call Crisis and ask to meet officers on scene. And that all depends on how much information 911 is going to get. Perhaps the caller would be able to be very clear on the need of the 911 call or the reason for the 911 call. And sometimes it's not, right? Sometimes our dispatchers are faced with, I need a police officer at this address, and that's all they're going to get. And so it's really a mixed bag on how law enforcement would reach out to us. So perhaps we're responding very shortly after they do, or perhaps it's from the officer, him or herself on the scene, who has assessed the situation and has determined that we may be helpful to resolve any conflict or challenges that they're facing. And I have to say that there's a training that a lot of our law enforcement officers have gone through over a decade. It's called CIT, Community Intervention Training, or Crisis Intervention Training. And it has made a huge impact on the access of knowledge that law enforcement officers have about behavioral health issues. Again, in Wisconsin, a behavioral health crisis has been, the way it's set up is that law enforcement responds first, as it's a public safety issue. But I do know that law enforcement and everyone in our community does recognize this is a public health issue. And they're more than willing to call and reach out for help. And so we have a very deep partnership and meet very regularly and update on services and what's available. So we spend an awful lot of time really making sure that relationship and what they know about services is as up to date as possible.
Excellent. Thank you for that. And I want to ask all of you one last question, and Carrie, we'll start with you, and then Melissa, you'll follow, and then Dr. Claire, you'll close us out. So Carrie, we can only imagine, those of us on the outside looking in, that this is a tough and difficult job. What brought you to want to be a part of this type of work?
You know, that is, I don't have a good answer. I don't have a specific answer to that, Brandon. I got a job right out of college, and I thought maybe I was going to be a police officer. I had some family that went down that path, and I thought perhaps I was. So I got this great part-time gig as a juvenile crisis counselor for this agency I had never heard of. You know, 24 years later, I'm the director of crisis services. It was serendipitous. I knew that I wanted to help my community. I've been born and raised, lived my whole life here in Kenosha. So it's really important that I can offer families and individuals to be as strong and healthy as possible, because I'm raising my own family here. So I think it's there's a level of passion, I think, but specifically, did I think I'm going to go into emergency mental health community services? No, I just kind of found my way here, and I just couldn't be happier that this is where I landed.
Excellent. Thank you for that, Carrie. Melissa, same question to you. What got you into this field?
I love that question. I just first want to mention to Carrie, I'm glad that you and that role have found each other, because just we can hear your passion come out, and you really service the community real well. So we're quite fortunate that happened, and that
Thank you.
connected that way. Yeah. So for me, I found myself just really loving the connection with the community, and with the connection with the community, that means the people, it means the spaces. And I felt my life really feeling fulfilled when I could offer myself to those things. And before coming to Kenosha Community Health Center, I really did a lot of outreach work, and with that, really gave me a good understanding and a pulse of what was going on in the community. So where I could fit myself in, and what I was able to extend of myself. And not only, when I say just myself, it even goes beyond me. It goes beyond into my family roles, and all of those connections that I've made along the way. I always look for those ties that I can pull together and to connect. And so with Kenosha Community Health Center, that came right along with me, and it seemed to fit real well. And again, going back to what Dr. Claire mentioned about that team-based approach, I kind of do that same thing in my own living. So along with our, resources, our partners, like with Carrie as well. And I just feel like not only does it service me and my family better, but even my extended family, which is my community. And so that is where my passion sits too. So just like Carrie as well, I think passion just has driven me into the position that I am in. So I really appreciate that question and that ask.
Thank you, Melissa. And then Dr. Claire, to you, what got you in this profession?
These are hard acts to follow. I really appreciate the opportunity to answer that. I really think for me, it's been being able to connect to people and try to find bits of hope, being able to instill hope when sometimes things feel incredibly bleak and it's difficult to take that next breath, and it will come if we can allow it. So hope.
Wow. Thank you, all of you, for those powerful last words, as well as giving information on these Kenosha County resources, emergency resources. I do want to point that out, that these resources are for emergency services and opportunities for all of our Kenosha County community. Just to know that these services are available to you right here in your city. So feel free to use all of the lines the phone lines that they've given out. And if it's too hard for you to remember, you can always dial 211, or you can go to the ESN website, which is www.esnkenosha.org. And if you're watching this Facebook live video now or days from now, there are some links in the chat that was put there for you, and those resources you can use that will connect you to Dr. Claire and Melissa, as well as Carrie. Ladies, any final thoughts, any final words you guys want to leave us with?
I just want to reinforce, if you don't mind, Brandon, and Carrie's brought it up, Dr. Claire and myself, but please, the listeners, just know that no care is going to be denied because of excess of pay. So for an inability to pay, I mean, so please reach out, and we're here to service you for wherever you are at.
Mhm.
Excellent, thank you for that. Anyone else? Last words.
Yeah, just to reiterate, Melissa and Dr. Claire, recovery is possible, and Dr. Claire's strong words of hope. Recovery is possible. Maybe you don't know how to get there, but no, it's possible.
Excellent. Thank you for that. The resources are here right in our Kenosha community. Please, please, please make sure you share this page so we can continue to build awareness around these emergency resources that are here in our Kenosha community, as well as feel free to have a conversation with someone and then invite them to use these resources if you think, or if they think that it is needed. We have many people here that are willing to help. So thank all of you guys that are joining this Facebook Live. Again, this is our Kenosha County virtual resource fair, and we will be continuing with our last resource fair, wrapping up the fourth one next month. So make sure you follow this United Way Kenosha County Facebook page and listen for the dates and times of when we'll be doing this again. Again, share this video, spread the word in our Kenosha County. We have these wonderful resources that are here. So thank you guys, and God bless. See you, ladies. Thank you.